I'm Dr. Sunil Havannavar, Senior Consultant Internal Medicine, Manipal Hospital, Sarjapur Road. Today, I'm going to discuss with you about the preventive health or preventive health care. So basically, what is preventive health care? Preventive health care is aimed at reducing the disease occurrence or the morbidity associated with it in an individual and hence reducing the incidence of the diseases in a community. There are three types of preventive health care: primary, secondary and tertiary. So what is primary? Primary is basically associated with improving the life conditions and improving your lifestyle and also health education. The most important part of primary health care is immunization. Recently we saw that COVID vaccine helped to prevent the COVID illness in many people. But this vaccination or the immunization is not just limited to kids. Even in adults we have vaccines. For example, the diseases like pneumonia and influenza can be prevented by immunization in adults. I want all the adults to go and meet your primary health care provider and ask for these vaccines. So what is secondary health care, preventive health care? Secondary preventive health care is basically to avoid asymptomatic disease to go into a symptomatic disease and hence reduce the morbidity and the suffering that can happen. The most important part of the secondary preventive health care is the health checks. What do the health checks do? Health checks can identify a disease in an early stage so that you will not suffer or the disease will not progress to a stage where it becomes symptomatic. In a recent past, we have observed that many celebrities especially had a cardiac arrest when doing a physical activity. As we know that all of us are different, our health and our predisposition to develop a particular disease depends on our background, like our genetics, our work environment, the lifestyle and many other factors, especially stress level. So before going into any heavy physical activity, I will advise you to go and meet your doctor and know your body well and then start exercising. Secondary, these health checks are very important for identifying the diseases which you may be predisposed to. For example, if you meet your family health care provider or a family doctor, he will know your family history, he will know your quality of life, he will know your lifestyle and he will also know your stress factors that you go through. So depending on that, he can precisely mention the test that you have to go through rather than you going into a long list of battery of tests. So it is better to ask your physician before going into any kind of health checks. Last but not the least, the tertiary health care is basically to minimize the burden. So it helps to a kind of rehabilitation in a patient who is already suffering from the disease in a physical, mental and social way. So as we know that the prevention is better than cure, the preventive health is very, very important in the future to prevent and reduce the suffering of the patients. Here at Manipal Hospital, Sarjapur Road, we provide all types of preventive health care programs. Please contact us for any help. Thank you.